I believe that developing your child's coping skills is the best preoperative preparation that you can do for your child. Is your child about to undergo an elective surgery and you're wondering what are the preoperative considerations that need to be done? Well, in this video, we will talk about anxiety in children as well as in parents before the surgery. We will also talk about what doctors check for before surgery, such as doing a history and physical examination, what diagnostic tests are needed, and if they are needed. Does your child need fasting? And we will also talk about informed consent as well as risks before surgery. Hi, I am Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Preoperative considerations in children. Let's talk about preoperative anxiety. Children who are aged 1 to 6 years old are most vulnerable to pre-op anxiety. A child who feels anxious before surgery has greater distress post-operatively or after surgery. Post-op negative behavior is 3.5 times greater in children who have pre-operative anxiety. And this post-op negative behavior may include nightmares, waking up crying, separation anxiety, temper tantrums, and new onset enuresis or bedwetting. Parents feel anxious as well. It is as if the entire family is going to undergo the procedure. The anxiety that a parent feels is transmitted to the child. And it has been found out that most parents feel more anxious with the anesthesia that the child is about to get rather than the surgery itself. And also, parents obviously are more concerned with the risks to their child rather than themselves. And also, parents feel the highest anxiety for their child who is less than 1 year of age and those with first surgical experience. Preoperative preparation. So in the US, 80% of surgical procedures in pediatrics are outpatient or same-day procedures. The best preoperative preparation has been found out to be the developing of coping skills in children. This is then followed by modeling, play therapy, tour of the OR, and printed materials. Then, your doctor would need to perform a history and physical examination on your child before the procedure. Your doctor will review all the organ systems, your child's medications and allergies, if your child has any previous surgeries or hospitalization, your child's last oral intake, urination, vomiting, or diarrhea, if your child has any recent illness, is there secondhand smoke exposure, your child's birth history, and maternal history. Then, fasting is important before the procedure. This is to prevent aspiration. And here are the fasting guidelines. Is diagnostic testing needed before surgery? Well, the tests that need to be performed before the surgery would be based on your child's condition and the planned procedure. Usually, a complete blood count, blood chemistry, and urinalysis are rarely needed in healthy children. Let's talk about informed consent. Well, in healthcare, informed consent is a process wherein the patient and the healthcare provider engages in a dialogue with regards to the proposed treatment, its nature, the consequences, harms, risks, benefits, and alternatives. The reason behind it is to support and respect a patient's autonomy. Now, how about risks? A discussion about risks with parents can give them perspective. Fear among parents stems largely from the lack of information rather than a higher risk. For a healthy child undergoing a simple surgery, the risk for adverse event is 1 is to 200,000. Hey, if you enjoyed this video, watch my other videos where I teach you about other child health problems.